Do you have a family history of breast or ovarian cancer? Are you scared that you might be affected by one of these kind of cancers at a very young age? Well, today's topic is about familial breast cancer. Hi, I'm Dr. Pragnya. I'm a consultant breast surgeon currently working in Hyderabad. About 10% of all the breast cancers are familial breast cancers. When you have certain inherited genes which are passed down from one of your parents, you might be at a higher risk of developing breast cancer, ovarian cancer, or male breast cancer. For most of you who've watched the show The Bold Type recently, you might know that the most common genes that increase the chances of developing breast cancer are BRCA1 and BRCA2. But there are other genes as well, such as TP53, CDH1, STK1. These are quite medical. These are the genes that might increase your chances of breast cancer. Please realize that just out of fear, you or your family members should not go and get yourself tested for the BRCA gene or any other gene. You will be referred to the genetic clinic if you have these following factors. You or one of your close relatives developed breast cancer at an age younger than 40. You or one of your close relatives developed breast cancer in both the breasts. You have developed a triple negative breast cancer, especially under the age of 50. 2 or more close relatives have developed breast or ovarian cancer. If any of your male family members develop breast cancer. Remember that all these family members should be of the same lineage or the same bloodline. When you reach the genetic counselor, you would be asked the following questions. Your family history, your family tree, the number of members of your family who have been diagnosed with cancers, if they have had more than one cancer in the family, your ethnic background, and how many people have been diagnosed with cancer and how they're related to each other. These are extremely important for you to know. If your genetic counselor thinks that you are at a high risk of any of these kind of cancers based on your family history, you would be counseled and advised genetic testing. The person who has been affected by cancer would be tested first, and if the gene is positive in him or her, you would probably be advised testing. So how is this test done? The test involves taking a blood sample or a sample of your saliva, and the DNA is tested for the altered genes. It might take around 8 to 12 weeks for the results to be known. And when you do get the results, it might be either positive, negative, or something called variant of unknown significance, at which point your genetic counselor will advise you how to go about doing the next step. Unfortunately, if you have been diagnosed with one of the genes which put you at an increased risk of cancer, do not panic. You have certain options. You will be guided the right way by your counselor about surveillance, which begins from a much early stage compared to the general population. Besides that, you also have different kinds of medical management with certain kind of drugs and surgical management, which probably involves removal of your ovaries or risk-reducing mastectomies. Your genetic counselor will talk to you about the options that you have if you have been diagnosed with the gene. Remember that knowing your family history is extremely important, but it does not mean that out of fear you run to the closest genetic lab and get your blood tested. It has a lot of psychological implications. If you have any questions, reach out to us on the numbers given below. Thank you.